We want to welcome any of you who are at the Douglas County Courthouse or joining us online. I'd like to pass along a bit of information regarding how we'll run our meeting on Zoom during this time of social distancing. If visual aids are used during the meeting, the presenter will share their screen with the call. Participants will not be able to view them without a computer, smartphone, or tablet. All participants will be entered into the meeting with their audio muted, meaning the commission and the public will not be able to hear you. Presenters will be unmuted when their agenda item comes up. We ask that all online presenters use good conference call etiquette and mute their line when not speaking and introduce themselves each time they speak. If you have a public comment on an agenda item or under regular public comment, please use the raise your hand function on Zoom. Just a reminder that if you have public comment on an agenda item, please wait until that agenda item for your public comment. Staff will call on you and unmute you. We ask that speakers give their name and address for the minutes and keep their remarks to 3 minutes. The county reserves the right to shut off their microphone and remove any speaker from the meeting if they are vulgar, rude, or inappropriate. A recording of this meeting will be available on our website after the meeting. We will get started with a proclamation this evening. Sarah, do we have anyone here for the proclamation?
Commissioners, I'm checking to see Janine Coulter is.
Yep, she's ready.
Okay, go ahead. Janine is here to receive the proclamation.
Janine, this is Commissioner Portillo. Would you like to say anything before we read the proclamation? Oh, and Janine, you are muted.
No.
Okay, I will go ahead and read our proclamation. Whereas Juneteenth is the oldest known celebration of the ending of slavery, dating back to June 19th, 1865, the day on which the Union soldiers landed in Galveston, Texas, with news that the war had ended and that all slaves were now free, even though President Lincoln had signed the Emancipation Proclamation 2.5 years earlier. And whereas Juneteenth has become a tradition of celebrations that began following the reading of the proclamation by General Gordon Granger in 1865, that has lasted over 150 years, and today is hosted in cities across America, featuring rich traditions, including celebrations in the form of festivals, parades, and oral histories. Also known as Freedom Day, it has continued to be a highly revered event across the country at a time for honoring one another and the memory of all those who endured slavery, and especially those who moved from slavery to freedom. And whereas Juneteenth allows people of all races, nationalities, and religions in cities across the country to join hands and acknowledge a period of our history that shaped and continues to influence our society today. And whereas Juneteenth today celebrates African American freedom while also encouraging self-development and respect for all cultures. Now, therefore, be it resolved that the Board of County Commissioners of Douglas County, Kansas hereby proclaim the celebration of June 19th, 2021 as Douglas County Juneteenth celebration.
Thank you.
Thank you. Would any other commissioners like to make any remarks?
This is Commissioner Reed here. Hi, Janine, thanks for joining us. I was wondering if you might know whether or not there's any planned Juneteenth events or celebrations yet that we are aware of in the community.
Yes, we are having a virtual Juneteenth this year. It will be on our Facebook page, which is the Lawrence, Kansas Juneteenth organization. Anyone can sign in and watch it. We also have it on our web page, which is also lawrencekssjuneteenth.com for our web page. And we have a very exciting, well planned out celebration, from music to oral history. This is just going to be amazing. And we're really, truly happy about putting this together because we were not able to meet in person this year. But it is a cultural event that we want everyone to celebrate with us. And so it will be June 19th, Saturday at 1 p.m.
Wonderful. Thanks for sharing those details, Janine, and thanks again for joining us.
Thank you, Commissioner Reed.
Thank you, Janine. This is Commissioner Kelly for being here. And that information. That was going to be my question. I'm just disappointed we won't get some of that delicious food in the virtual
know.
celebration. So but we'll have something to look forward to next year. Thank you.
Yes, thank you.
This is Commissioner Portillo. Thank you so much for joining us.
Thank you for having us.
Thank you for sharing all the information about the celebration.
Okay.
We will move on to our consent agenda. Would either of the commissioners like to pull anything from our consent agenda?
No.
Sarah, do we have anyone at the courthouse who would like to pull anything from our consent agenda?
No, we do not.
Jill, do we have anyone online who would like to pull anything from the consent agenda?
No.
Then I am looking for a motion for our consent agenda.
Commissioner Reed, I move to approve the consent agenda in full.
Second.
All of those in favor, please say aye. Aye.
Aye.
Thank you. We will move to general public comment. I do just want to remind folks that if you have public comment for one of our 2 regular agenda items, please hold your comment for that item, but we will take regular public comment now. Sarah, do we have anyone for general public comment?
Is anyone interested in general public comment? No, we don't have anyone for general public comment.
Thank you. Jill, do we have anyone for general public comment online?
No.
Thank you. We will move to our regular agenda. Agenda item 4.1, legislative update. Sarah, do we have a presentation for this?
Yeah, thanks, commissioners. I'd like to introduce Stuart Little and Mallory Letts with Little Governmental Relations. They were bumped from our meeting last week and are here to provide us a end of session update. And today is sine die, so I think they've probably got some updated information to present to us as well. So I'll turn it over to Stuart.
Good evening, Sarah and commissioners. We appreciate the opportunity to give you all an update. You have a written report, and last week we were prepared to talk about what was happening and what might be resolved by the end of the legislative session. And one of the key pieces of legislation we were going to talk about, the governor vetoed. So it's good you bumped us to another day, because we've now can cut probably the most complex, challenging part out of our presentation. I wanted to give you just a brief overview of kind of a couple of things that have happened here at the end of the session. Mallory's going to talk about a couple of big pieces of legislation, including the one that was vetoed, just to clarify a couple of issues. And then we'll wrap up pretty quickly and let you all get on with your work. When they came back for the wrap-up session May 3rd, and I think the last time I talked to you all, I think I told you it'd take 2 or 3 weeks to get everything done. They got done in 5 days, which is the second fastest they've done in probably the last 30 years. The reason I think they resolved all of their issues was they abandoned some of the K-12 issues that had been divisive. They decided to just pass the K-12 budget, put through the stuff that was the least controversial in public education, and go ahead and move that forward. They also had put together a couple of bills that were related to COVID relief, and they managed to get those wrapped up. So they did go quickly. When they came back, which now is 2 weeks ago, they did a variety of vetoes, overrode a number of vetoes. The governor vetoed a tremendous number of bills after the end of the legislative session, the regular session. The legislature overrode many of those. One that they failed to do was the transgender sports bill, but the one that had some impact on us is Senate Bill 50, which is the income tax bill, the big bill that was going, essentially most of it was corporate and business tax reductions, but some of them had to do with folks that itemized and standard deduction changes. And the governor vetoed that, said we don't have enough state revenue to do that right now. But she vetoed it. Revenue estimates came in higher. And so I think that gave some folks some energy to go ahead and override. So they did override that tax bill. I think one of the issues that we'd been monitoring for you was the inclusion in that of a marketplace facilitator tax. So that'll be a new tax that will begin July 1 of this year that will be levied to collect sales tax and compensating use tax, and eventually, I think by 2022, transient guest tax as well for internet services that facilitated sales. And if they had not been collecting those would begin to be collected. So that was one issue that was vetoed, passed in the list of other things. Otherwise, they resolved the budget. They resolved K-12. Mallory's going to talk about 2 of the COVID-related bills that were dealt with at the end of the session.
Awesome. So I was prepared to talk longer than Stuart tonight for, for once, but my presentation might be pretty short because my lengthy explanation of Senate Bill 273 is kind of out the window at this point, and I couldn't be happier. So I think we've all, probably between all of us on this Zoom here, we've spent way too many hours trying to figure out the ins and outs of what this legislation does. So I'm glad that we don't have to anymore. So I know you're going to be talking tonight about your mask orders and kind of how you're moving forward. So short story, this legislation no longer, because it doesn't exist, it won't have any impact on what you all decide to do tonight. So hopefully you can breathe a little bit easier because of that. But as far as, you having to worry about setting aside or embargoing any of your federal funds that are coming to you, that is no longer of a concern. So unless there are any questions on that, I'll move on to something that will still impact you going forward. Sort of related, but not exactly, is the House Bill 2313. This is more along the lines of property tax reimbursements due to disaster emergency declarations. So not COVID related at all. And this will be beginning January 1st, 2022 and going forward. So this applies to any disaster declarations, and I'll kind of walk through some of the eligibility provisions of the bill. It's only eligible for actual days that a business is closed down or limited anyway in capacity, and the formula for reimbursement is 1/365th of the amount of taxes levied for each day the business is shut down. If the state or if somebody besides the county issued the shutdown or restriction, then they're responsible for reimbursing those costs. And the maximum refund for a business or property owner is $7,500. And the reimbursement is divided between property owners and business operators if they're not the owner by 50%. So a couple of other things in the bill that we'll be watching going forward as well. There was some conversation last session, you'll remember, about kind of this notion of competition between for-profit businesses and governmental or nonprofit entities. And so there will be a study conducted over the interim about those issues. So we will be watching that closely. Lastly, I would just mention that it also includes the 20 mil statewide levy for schools, which is obviously very important. So kind of a mixed bag of some different things here in this bill, but the governor signed that, I think, just a couple days ago. So I would mention one more thing, I think, before maybe we'll see if anybody has any questions. The Legislative Coordinating Council met today, that is legislative leadership, to decide what we do about the emergency declaration that expires in less than 48 hours now, I guess. So they did not take a formal vote on it today, but they are expected to meet again Friday to decide whether or not we extend the disaster emergency for 30 more days, or if we get rid of it. So I think there's quite a bit of will to want to get rid of it right now by legislative leadership. So there's just people aren't quite sure what that means in terms of federal funds coming down, emergency management. So the Adjutant General was there today to discuss some of those concerns. So we will obviously be watching that as well. But those were kind of my three big news items. So happy to take any questions.
This is Commissioner Portillo. Thank you so much for that overview. I do just have a question about that study comparing nonprofit and governmental entities and for-profit entities. You mentioned that there will be a study in the interim. Who is responsible for running that, and kind of how are they going to go about doing that research? Do you know?
So this is and Stuart might be able to fill a little bit more in on this, but this will be done by the Legislative Post-Audit Committee. And so this was requested basically it was requested by the Senate Tax Chair, and the Senate Tax Committee approved that, and then ultimately it was approved by House and Senate and Conference Committee, but the legislative post audit, I don't know how many studies they do per year, Stuart, but they do everything from, K-12 funding to this kind of stuff to correction, looking at things related to corrections. And I'm not quite sure what the date on that was, if this was summer or fall or toward the end of the year. So I can look back at that.
Yeah, and I think, and that legislative post audit is the nonpartisan professional staff for the legislature. So we're not contracting with somebody that we're going to have to question the perspective or any of those kinds of things. It is going to be the nonpartisan staff that'll be doing the work. And I believe they have to report back to the 2022 legislature. So it's going to be within 6 months. Normally you're on about a year lag for a 6-month audit, but this given some of the emphasis behind this, I think folks are interested in seeing it done. So I think it has to be back by that point. But
This is Commissioner Portillo. Just one other question on that. So now that this isn't COVID specific, this has to do with any disaster that any level of government is calling that may shut down a business.
Correct.
Okay.
So,
That's a bit broad.
Yeah, and this is Sarah. I think that's something that I think we need to look at as we move forward in terms of how our disaster declarations work. I mean, in most cases in Kansas, a disaster declaration involves a tornado. I'm not sure. I want to read the legislation and talk about if it's related to some sort of shutdown, or is it just eliminated by virtue of Mother Nature? And so I think, but there already is legislation on the books. There's already statutes related to property tax relief for, any sort of property that's in or residential, particularly I know residential in our last case in May of 2019 related to tornadoes and those kinds of disaster declarations. So I'm counting on our appraiser and our emergency manager to do a little bit more work into how this fits inside of what our existing what we already have existing.
Yeah, I think Sarah's exactly right. I mean, if if a tornado comes through and it wipes out some shops en masse, you're not liable for anything, right? I mean, even though if they're not operating because you didn't close them down. So I think one of the examples used, I think several times in committee was, well, what happens if you need to shut down a bridge for whatever reason and it impacts, 4 or 5 businesses down the street? Could they argue, oh, well, you closed that bridge and it had this impact on my, of doing X, Y, and Z to the number of people coming in and my revenue? So I mean, I think there's definitely some things that, some situations that, might get a little murky with this, but.
I would note there's this bill and the other one were vastly different bills the last week of the regular session, and they probably transformed themselves twice more during the wrap up week. And these were, as you recall, I think the week before we got before they came back and I talked to you all, some of these were retroactive going back to last year and getting, so I'm amazed anything kind of emerged out of this, because this kind of ends up being, well, it has the potential to have an impact. It's almost separate and distant from everything that got the whole conversation going, which is, it's been interesting. I would note one other thing that Mallory mentioned. There was no effort to override the governor's veto of 273 today. So that chance has come and gone. So nothing will happen there. I do have a couple of other topics I wanted to mention real quick of significance, just very briefly here. There's been creation of a new fund called Kansas Fights Addiction Fund. The Kansas Attorney General is in charge of that. It is significant because that is where all of the future opioid settlement dollars are going to go. Unlike the master settlement agreement in tobacco, which was a structured settlement and we got money coming in every year, this is going to be random depending on the resolution of lawsuits and those kinds of things. But the Attorney General has told the legislature that he anticipates somewhere in the neighborhood of $2 billion eventually coming to Kansas. It goes into this fund. The Kansas Association of Counties, League of Municipalities, to their credit, managed to carve out 25% of any revenue that comes in, and they will be in control of 25% of what comes in, and we'll create a system and a structure to distribute those to local units of government to make use of that for everything from prevention to treatment to all kinds of things. So going forward, there's only $4 million in it right now at the beginning of this, but going forward, this is going to be something that's going to be valuable for us to keep our eyes on and watch as it evolves. Three other things I would mention that are budget related. The budget bill that was finally passed includes an addition of $53 million for the Regent system, and then it'll have another 53 next year because of very complex maintenance of effort issues related to federal relief that was coming in and what was going on in those dollars. So that's kind of an unanticipated boost that came in. The suicide prevention program that we'd been watching, the long-term funding was not resolved. I think the legislature at a certain point realized, oh, this doesn't happen officially till July 1 of 2022. So they punted that at the end. We still have to get the implementation money and then the long-term operational costs, but there was $3 million added to cover that as well. There were a couple of other small bills that we had testified on, one about driver's license for court service and community corrections folks. We testified in favor of that, as well as Burt Nash and the Sheriff's Department. That bill was passed as part of another bill. So we did a lot of, I feel like, good work this year, in addition to getting the crisis center funded again. So that's done, and by the way, out of the way. So now at this point, with the legislature gone, we'll kind of revert back to our monthly reports. We'll keep you on top of interim committees. And at some point when your administrative staff are ready to talk about what we need to be preparing to do next year, we'll be ready to do that. Happy to answer any other questions you might have.
This is Commissioner Portillo. I do just want to say thank you for the work on that driver's license bill. I think that will be a huge help to the citizens of our community. I also had a question about the opioid funding that will be working its way through the Attorney General's office.
Right.
Do we have any idea of how he might manage those funds? Would that be distributed via grant processes? Would that be distributed via special projects? Do we have any understanding of that?
It sets up a structure with a, and this is not without some controversy and discussion, because we have two state agencies that are already managing the distribution and licensing and of substance abuse treatment dollars, and KDHE and KDADS. So this essentially is outside of that structure. And it would be, there's a 14, 15 member committee that with representatives of a variety of organizations, and a process, which it will be, and you describe it exactly, it will be a grant distribution process. They will have an annual process, but I think some of the awards can be made for multiple years. I think one of the things that's going to be challenging is that if we get $2 billion into this fund, that's a multiplier time the amount of dollars we get as a state, and how may those things fit together in a distribution process going, how that would work. And by the way, so that's the Attorney General side. On the municipal fund, Kansas Association of Counties, League of Municipalities, and the Attorney General's office will oversee that local government distribution process. And I think the structure and the organization is supposed to be the same grant-wise, those kinds of process. I don't believe it has the same committee structure as the other one. Mallory, if you know, I can dig into that, and we'll send you the SUP note, but that's generally it. It is going to be grant distributed, controlled by the two state associations plus the Attorney General's office.
Thank you. Those were all of my questions.
So Commissioner Kelly, I didn't have any questions. Appreciate the update. Thank you.
Commissioner Reed, I don't have any questions either, but thanks for sticking with us last week and coming back again this week. We appreciate it.
No problem.
This is Commissioner Portillo. So we will open this up to public comment. Sarah, do we have anyone at the courthouse for public comment on this item?
I don't believe we have anyone for public comment on this item.
Jill, do we have anyone for public comment on this item online?
No.
Well, thank you very much, Stuart and Mallory. As Commissioner Reed mentioned, we do really appreciate you sticking with us last week and this week. And thank you for wrapping up the session for us.
Good luck tonight.
We will move on to item 4.2, a discussion of our health orders. I do just want to say, as we move into this item, a huge thank you to our community for sticking with us through our health orders thus far. We got through a large commencement at KU, as well as wrapping up of 3 of our 4 school districts, with 1 school district just having a couple days left. So a big thank you to everyone for getting through a number of those big events. And I am looking forward to seeing what kind of recommendations our public health officers have for us to transition to. Sarah?
Thank you, commissioners. This is Sarah Plinsky, County Administrator. I know we're moving a few other people into the panel as well. I'd like to, before I turn it over, I'd like to introduce a few folks, and then say a few things about what this group has been working on over the last week. I want to introduce Dan Partridge, our Director of Public Health, Dr. Thomas Marcelino, our Public Health Officer, Dr. Jennifer Scrimshire, our Deputy Public Health Officer. I believe we should have Brad Finkeldye, who is counsel to the Health Department, joining. Yep, okay, yep, I think that's Brad, so I'll promote him. All right, this is our team that's been working on health orders, and based on, before I turn it over to Dan and I believe Dr. Marcelino and Dr. Scrimshire to make their presentation, this team did meet based off of the commission's comments last week about with maintaining the health order through its expiration today. And we did get some information related to schools specifically. I think what I can say is that every school district in Douglas County, with the exception of Baldwin schools, their last day of school was either today or earlier. So every school district in Douglas County, with the exception of Baldwin, finished school today. And we've had conversations with Baldwin schools, and their last day of school is Friday. And they have indicated that they will continue to uphold their mask order through the end of their school year. One of the things that I'm not sure a lot of public understands about this process with health orders is that upon the passage of Senate Bill 40, school districts and universities were responsible for their own masks orders. And so each district had their own orders in place. So while they may look to the county for guidance, they have had responsibility for their own orders. And we did verify with the superintendent of that schools that they plan to continue their order just through the end of the week, through the end of the school year. With that, I just really want to thank this team for all the hard work that they have put in during this entire process to evaluate where we are, to review difficult statutes and new legislation in terms of what an order should be, what an order can be, and what an order can't be. And I think you're going to hear more about that as we proceed tonight. I believe I'm turning it over to Dr. Marcelino to say a few words, and then I believe Dr. Scrimshire has a PowerPoint for us. Dr. Marcelino?
Yeah, thank you guys. And, in retrospect, I think letting the order continue this week makes a lot of sense. And I'm glad we were able to do that and give us that window to let schools kind of come to completion and get through those graduations. So, I think we were going to move into our PowerPoint presentation kind of to give background and info and data. And so I don't know if Dan wants to speak first before Jen's PowerPoint presentation, or if we want to just start right into that.
No, let's dive in. I think I've got slides 15 and on, so.
All right. So some of this is similar to last week. Just going back over what the CDC guidelines say, making it maybe a little bit more clear. People who have been fully vaccinated get to do the things they were previously without having to wear masks or distancing. You can fly, you can travel, you don't have to test your quarantine, and can fly, travel internationally. depending on where you're going. There may be some different rules as far as testing, but shouldn't have to quarantine when you return. I will say this is as of, right now. I think what we've seen in India, I think there may have been some restrictions with travelers returning from there. And that will continue to be the case as we, move forward over the next months, years. The other benefit is if you're fully vaccinated, you should have to test frequently if you've been exposed, and you don't have to quarantine, which I think is probably the biggest thing. Aside from the benefits of the vaccine itself, not having to quarantine is huge for a lot of people. The caveat to this is that you can't, you still have to watch out for symptoms. So if you're exposed and you develop symptoms, you still have to make sure that it is not COVID. We see a lot of people who say they thought it was just allergies. These things, as stated in the first slide, do not apply to unvaccinated persons, partially vaccinated persons, or those with weaker immune systems, potentially. Same thing, Pfizer and Moderna, 2 weeks after your second dose, Johnson & Johnson or Janssen, 2 weeks after the only dose. If you have a problem with your immune system, you should talk to your doctor to determine whether or not you can, you have to continue with the precautions that you have, or you can forgo some of those. This is the updated poster. I love this poster. I think it's easy, and they've made it even easier. On the right side, you can see there are 0 masks on the vaccinated folks. Exceptions to these rules are healthcare facilities, correctional facilities, homeless shelters and facilities, and schools. If you have been fully vaccinated, you still have to get tested if you're having symptoms, and follow all state, local, federal, tribal, territorial recommendations, restrictions. For schools, there's been a lot of confusion, I think, specifically in regards to schools. With distancing and mask guidance, schools kind of get lumped in with other groups, but the CDC has never said at any time that kids don't need to wear masks. There are exceptions, as there are with everyone, but the CDC has been pretty clear about kids need to remain masked. And then the 3 feet versus 6 feet, this recommendation came from a couple of studies, several studies, showing that kids do not tend to transmit it to other kids, and the distance of the particles that travel. So in certain situations, they can be 3 feet apart as opposed to 6 feet, but it's only for elementary. For middle and high schools, they have to have a low prevalence of disease in the community, only if they're masked, and the desks have to face the same direction. This doesn't apply to adults at all, because transmission between adults is more common. And then it doesn't apply to activities where there could be particles that get spread easily, like singing, shouting when they're eating. And then in common areas where there's a bunch of people. And I didn't go into cohorting much, but these students also need to be cohorted as they get older. I'm going to pass this to Marcelino to talk about kids more.
Yeah, so if we look at statistics in children, which is, it's important to kind of look at that because children are different. And you want to go back? Yeah, okay. So, unfortunately, there's been 308 deaths reported cumulatively thus far during this pandemic for children. To kind of put that into perspective, during the 2017 flu season, the flu caused 186 pediatric deaths. About 14% of the cases are in children, 2% of total hospitalizations. The hospitalization rate is 0.8%. Children make up 0.06% of the total deaths, and about 0.01% of COVID cases in children resulted in death. think it's important to recognize that there's probably many more cases that weren't caught or picked up. And so those numbers in some sense are difficult because we're basing those on positive test results. So there are probably many other infections that weren't picked up by a positive test result. You can see, the graph of kind of throughout this pandemic, we've been dealing with waves, and the curve has kind of been a mirror image of itself. And you wonder if that's kind of what we're going to go on to expect moving on into the future. We've kind of gone up into this little hump. Now we're coming back down. We're across the country letting up on social distancing and masks and things. And so really the next 2 weeks, next 3 weeks, next 4 weeks is really going to be an experiment in this country to determine whether or not it's going to work to give up some of these mandates that we've had. And, I watched the KU Medical Center team every week to get info from them, and Dr. Stites and Dr. Hawkinson. And Dr. Stites up there had said that really what we're going to see is going on to the middle of June, it's going to really give us an idea as to whether or not what we've done with mask mandates across the state, across Missouri, across the region, what that's going to do. Are we going to see another bit of a, uptick in cases and another mini spike, or are we going to be able to hold kind of where we're at based on, how well we're doing with vaccines and things. So this graph was just meant to show that, about 20% of the cases right now are in children. And so that's a little bit higher. In the beginning, it was 2.6%. And so now we're kind of to a point where there's more cases in children, which we expect with, kind of how the vaccinations are playing out. So more adults are vaccinated. Obviously, kids don't have the opportunity to be fully vaccinated. So we're seeing more infections in children. Children are driving many of the infections right now. Dr. Schrimsher, I'm not sure where you're going with this slide. If you want to.
It was about the same thing you just said. There was an increase in the percentage of cases. So looking at that American Academy of Pediatrics weekly reports that we put out, that last graph on the far right side, it shows you the number of the percentage of child cases, and for why it looked like it was going up. And there was some question as to whether or not it was due to the B117 maybe having a higher affinity than previous mutations of the virus with kids due to the ACE receptor binding, or it was just because there was a general increase in cases, and so we saw more cases in kids. And at the same time, we were vaccinating adults. So I'm basically saying the same thing you are, Dr. Marcelino. And this percentage should drop as we vaccinate more kids, I expect. Sorry. Back to you.
Yeah, so, essentially, I think that where we're at now in our county, and, we know that there's concerns about children not being vaccinated and that younger children haven't had the opportunity to be vaccinated. But really, the reality of this virus is that children do, for the most part, really well with fighting off the virus. That 94% of children had asymptomatic, mild or moderate disease. They're less likely to develop serious illness or die. And with the vaccine now available, we're starting to see more and more 12 and older kids get vaccinated. We're hopeful now that the Moderna vaccine will be approved as well. And the bottom line is masks are still recommended for children unless they're fully vaccinated. So, on one hand, we do worry about the spread in children. On the other hand, we do realize that they are in the low risk category. And so I think that's what allows us to kind of move forward as a community. We also know that now school is out and we're moving into summer sessions. University of Kansas is moving in now into a summer session. So the risk profile, our community has diminished compared to where it was, a month ago or 2 months ago or 3 months ago. Every vaccine that we give, we improve that profile. And, I think that we recognize the fact that, kids are at risk, and we want to, reinforce that we do continue to recommend masks for children until they're vaccinated. And that's going to be important as we move forward this summer. And, the big issue with children is this syndrome that we've seen. It's MIS-C. It's an inflammatory syndrome that can occur in kids, and it is rare. We're still learning a lot about it. Prognosis is uncertain. I did just see a study that came out that said that they are hopeful that many of these symptoms wear off after weeks to months, and kids do improve. But you can see that the incidence of COVID in New York State was about 322 per 100,000 for children. And out of that, there were 2 children per 100,000. So, that accounts for about 35 deaths in the 3,700 patients. And so that's a big concern with COVID. And it's important, that we recognize the fact that, kids aren't 100%, immune to the effects of COVID. And if your child has any of these symptoms or has any problems, they seek treatment. But this is something that we just pay attention to. There is long COVID in children. And, I think just as in adults, there's long haulers that we see. And Dr. Scrimsher, I think you had some info on this slide you wanted to talk about maybe.
Yeah, there's very few studies. Apologies if you can hear lawnmowers. Happens every time. I just was on a call this weekend where this was the topic, and there's some studies, but there's not a ton of data. This one is from Russia, actually, and it's not peer reviewed, but it looked at 500 hospitalized kids and found that almost a quarter of them had symptoms. I think the median duration was like 243 or 250 days. Most of the symptoms were fairly mild, but I mean, these are kids. And it was more common in the 6 to 11-year-old age group. I thought it would be more common in the 12 to 18. But again, there's not much data available. This is new for everyone. So hopefully this isn't as problematic as it has been in adults, but it does exist. I think I'm passing it to Dan now, I believe.
All right, so the conversation last week talked about providing guidance to different sectors in our community. And so I'm going to run through some of that, and I'm going to try to do it all without going through the slides. So I'm going to start by taking us back to the smart safety guidance that we've been pushing out and trying to just raise awareness on.
This is Commissioner Portillo. Dan, I don't know if I'm the only one, but I'm having a hard time hearing you. You seem to be breaking up a bit.
Let me try to get on a microphone here then. Is that any better?
I think that sounds
Is this
better.
any better?
Yeah.
Okay. Just stop me if it starts breaking up again. So smart and safe was where I was starting. That's the guidance we've been pushing out for many, many months. And I would just have to say, I'm 110% convinced it works. I believe go on the Kansas, compare the disease rate, the hospitalization rate, and the death for Kansas all by driving the disease rate down in this community. And we've done that by and large by really 2 things, wearing a mask and practicing social distance. So this guidance that you see for grocery and retail, parks and rec, libraries, conference events and meetings, all kind of stem from those two branches of the tree: wear a mask and practice social distancing. So the universal guidance for anyone in the community is, if you're over 2 years, if you're 2 years or older, wear a mask if you can't practice social distancing. And if you're an employee that works in any of these sectors that we provided guidance for, wear a mask. Most of the other things really about how to practice social distancing. 50% of capacity, that's an enabling condition to help practice that social distancing. Posting signage saying to people, before you enter, if you are symptomatic, please go home, because staying at home and not being around others, if you're symptomatic, that's social distancing. Then most of these different guidances have iterations of how to separate different tasks. So for grocery and retail, checkout and workstations more than 6 feet apart. In library, computer stations more than 6 feet apart. Conferences, meetings, gatherings more than 6 feet apart between family units or social cohorts. Restaurants and bars, space out the dining tables more than 6 feet, and no bar service, because it's really very difficult to maintain that social distancing between a bar patron and an employee working behind the bar. Exercise equipment at parks and rec. And then for conferences and events, prioritize outdoor and online events. All of those things are really around social distancing. And then lastly, screen employees, and if you work in sectors like meeting spaces, conference events, restaurants, bars, parks and rec. The other things, the other tenets in these bullet points are really around practicing good sanitation and good hygiene, enhanced cleaning and sanitation, not only of restrooms, but common touch points. When you have common touch surfaces in restaurants and bars, like payments and menus, tent tables, things like that, remove them. Remove any kind of common touch point whenever you can, these high contact services. And then of course, it's always true, practice good hand washing when you work in these industries. And then finally, on a couple of them, parks and rec and restaurants and bars, the guidance asks that you consider maintaining a log of guests or patrons, and that's to support good disease investigation and contact tracing should we have an outbreak in one of those two events. And primarily that's because when you're at a restaurant or bar, or when you're at a gym, or doing physical exercise, the intensity and duration of those close contacts events is even higher than in other settings. So that is how I wanted to handle the different guidance that we have. We have it ready to put out on our website, just ready to kind of absorb any feedback and add or adjust as needed based on our conversation tonight. I'll turn it back over to.
This is for Sarah, but I think you covered a lot of it. And before you go, I had a question about 497 still being in session, maybe.
This is Sarah Plinsky, County Administrator. Thanks, Dr. Scrimshire. My understanding is USD 497's last day of school was today. Eudora schools, today is their last day for students. Their staff will be, and this is the same with USD 497, staff will be on duty for a number of days, but students will no longer be in the buildings after today. The only district that will still have students in schools is Baldwin Schools. And I did want to say, and I did cover most of this at the beginning, that we really did talk through, with the order lapsing, what options were available. And I think, Brad Finkeldye is here to talk to us about really what an order is and how they need to be structured to be least restrictive. And so I can, I think he'll talk a little bit more about the complexities that go into orders with that process. We talked a little bit under our legislative update that House substitute for Senate Bill 273 was vetoed by Governor Kelly. It had a very significant ramifications on county government related to mask mandates past May 31st. That was vetoed by the governor, which will allow local units of government to control local funds sent to us by the feds for purposes for local relief the way we had hoped to moving forward. So that was definitely part of our conversation as we prepared for this work session, but that has been resolved since this time. So I think at this point in time, you can advance it, Dr. Scrimshire, and I believe Brad Finkeldye is going to talk a little bit more about specifically some of the complexities with health orders and what we can and cannot do. Brad?
Yes, thank you. Obviously, you've heard some of this before, but under SB 40, we have a new set of rules in which we had to enter this last order and have to have an expiration date, which of course is set for today. And so if indeed we wanted to extend the order, or the order was extended, or a new order was issued, I should say, actually, a new order was issued, we would reopen the challenge, the ability for it to be challenged under the 72-hour rule. And then we'd have to show, if it was challenged, we'd have to show we're fulfilling what we intend to fulfill, and that we're doing it in the least restrictive way manner. And that's that 72-hour, they'd have the right to have a hearing in front of a district court. You know, we had that concern last time. I will say there was I knew of about 15 across the state. To my knowledge, all of the orders were upheld, but certainly that would be a possibility if we extended it. You know, certainly if we talk about age-specific mask mandates, that would be something we'd have to try to, we could certainly defend. We could certainly try to defend that. There's less information, as the doctors talked about. And so, that could be a difficulty depending on how that was challenged and what we had to uphold as it being the least restrictive. And then, of course, the last issue related to age-specific mask mandates is, enforcement and the legal responsibility. I mean, if a 10-year-old is not wearing a mask, and you wanted to enforce that, how would you enforce that? You can't issue a ticket to a 10-year-old. You issue it to the adult. Is the adult have the legal responsibility? That sort of issue of enforcement is certainly a tricky issue if indeed you had an age-specific mask mandate. Obviously, enforcement in general, if we wanted to do some sort of order that was only unvaccinated people have to wear masks, that again, how do you prove whether or not they're vaccinated or not when you go to the enforcement? Because we can't have that information ourselves. And so, issues like that, certainly we have some enforcement issues, but we could talk through those depending on what the commission wants to do. And finally, I would say it was noted earlier that the schools set their own rules. So, we talked about Baldwin being in session and Baldwin having their own school-specific rule. Nothing that the county commission does or the expiration of this order would change could change what Baldwin wanted to do. Obviously, Baldwin could make any decision that they wanted, but the county commission cannot make a decision inside those schools. So those are the main issues I wanted to cover, but happy to answer questions when we get to that point.
Sorry, so did you want to talk first?
No, I did that on accident. I apologize.
Oh.
Go ahead.
So similar to last week, the proposal would be to let the current order expire. We still strongly recommend masks for anyone 2 or older when indoors or when outdoors in public around others and unable to distance. The role of the public health department is to continue to provide data and guidance using metrics to dictate recommendations. Still place a spotlight on identifying safer businesses, those that do have things like requiring masks and distancing customers, and then continuing to develop an operational strategy for the future. And this was the Smart and Safe graphic. If the commissioners decide to go with this. That is all. Thank you.
Yeah, so this is Dr. Marcelino. You know, I know you're looking for guidance from us. And, you know, I feel like as the health officer, from what I've seen the whole entire last year, you know, we've based our orders and recommendations on the best available science. You know, we've put the health and safety of Douglas County at the forefront of all of our decision. We've adopted, you know, orders that are specific to our jurisdiction. You know, we've worked together with a team of leaders, Douglas County leaders, to assure that we're doing the best thing for the county. I think this has been a process. And as we've learned more about this virus, we've come to this point of the pandemic where I think the widespread availability of an efficacious vaccine, the local national decline in case rates, it's now put our county in a position to lift our local order. In addition, we've continued to review all available science and data. We've considered our local factors and unique community. And we've supported throughout this process science and the CDC and our governor. And we support and align with the CDC and governor at this time. So in my opinion, we're able to let the current order expire. And with that said, we strongly recommend following CDC guidance, and all citizens that are unvaccinated should continue to wear a mask until they're fully vaccinated. That's the key premise behind this recommendation, to let the order expire. And I know that puts the responsibility in the hands of the citizens. And so, you know, Douglas County has done a really good job up to this point. I'm confident in our citizens. We've thoughtfully considered additional orders and orders that are specific to certain sectors of the population. And I just don't feel that that's necessary at this time. It might be necessary in the future, but I think at this point, we're able to move forward. And so that's where I wanted to, you know, end my recommendation.
This is Commissioner Portillo. I want to say a huge thank you for the presentation and for all of the input. I do really appreciate you all taking the conversation that we had last week and going back and really looking through the data carefully when it comes to children. And I appreciate that. I appreciate this recommendation as we get to the end of our current health order. I do just want to kind of clarify from a process standpoint. Last week, what we decided is that we were letting the current health order continue. This week, what we have in front of us is a recommendation for recommendations. Our current health order is expiring. So I just want to make sure we actually, as a commission, don't have anything to vote on at this point, because we're just having recommendations put in front of us. Do we need to vote on these recommendations, Sarah?
No, that's correct, Chair Portillo. There is no need for the county commission to vote on recommendations from the health officer, and there is no proposal for an order in front of you.
So we will have questions, open this up for public comment, and have discussion. At the end of it, we will have no vote, but we will continue with the recommendations that were put in front of us from our county health officer.
That, I believe that's correct. Thank you.
Fantastic. Those are all of the questions that I had. I'll open it up for questions from other commissioners.
I don't really have any questions. I just want to say thank you for considering kids. And I appreciate what you said at the top, Dr. Marcelino, about recognizing these big gatherings that we had and are concluding today. I'm going to kindly disagree with Sarah. I have some knowledge of what's going on in the Lawrence Public Schools, and our elementary kids have a half a day tomorrow, and so do our middle school, so do our high schools, and a full day at elementary. But I also know that the Lawrence Public Schools do require masks for their students and for their staff for the remainder, and have expected the same for summer. So based on what I've heard tonight, I'm real confident with the direction that we're going, and the recommendation or proposal that we have from our health department. I think the concerns that I had last week have now been addressed, and really appreciate the time that was taken to consider them. So thank you.
I apologize for that, Commissioner Kelly. I'll have to check my sources at the school district to make sure I get the proper information, but thank you.
I just want to make sure that kids come to school tomorrow, that they don't think they just got a free day. So I just wanted to make sure that we have a lot of yearbook signing that needs to happen, and end of the year parties that are very important. So.
This is Commissioner Reed. I don't have any questions to add, and just want to echo gratitude for the team that that's in front of us, and I really appreciate you bringing back a lot of really great information, I think, about some clarification of how we move forward, and would agree with Commissioner Kelly's comments that I'm feeling much more confident about this recommendation than I was 7 days ago. So thanks for coming back to join us this evening.
This is Commissioner Portillo. If we don't have additional questions from commissioners, we will open this up for public comment. Just a reminder for folks giving public comment, please share your name and address for the minutes, and keep comments to 3 minutes. Sarah will help us keep time, and I will help us keep time as well. Sarah, do we have any folks in the courthouse for public comment?
Do we have anyone here who'd like to speak on this item? Please come forward. You're gonna turn on that microphone, but you'll speak into the camera like last week.
Okay.
Really close to it.
Okay. My name is Rachel Price. I'm from here in Lawrence. I just want to direct comment to some of the things you said last week. I just want to remind you again that this illness has over a 99% survival rate for most, and even most older people aren't dying in massive numbers. So whatever happened to risk assessment? Last week, you said you're concerned for those who can't receive the vaccine. That's children. I know you talked about children tonight. Again, the science shows children are not at risk from COVID, nor are they spreaders. Dr. Scrimsher's argument for masking children is that one death is too many. So are you concerned about the greater good or the one individual death? The greater good for kids is to take off the mask. Dr. Scrimsher also said wearing a mask is easy. I'm guessing, Dr. Scrimsher, you don't have children. And I don't think the other 2 women commissioners have children either. I'll assure you, wearing a mask for children is not easy. And it does cause harm. And there is plenty of peer-reviewed science that says otherwise. The CDC right now is investigating heart issues for teens that are receiving the vaccine. There have been over 2,000 reports of adverse events from the vaccine in teens alone. There have also been over a dozen deaths in teens from the vaccine. Some of the issues are serious: heart attacks, brain blood clots. Number 2, you were also concerned that the unvaccinated will not adhere to the honor system and wear their masks as directed. I think you're asking the wrong question. The question is, do the unvaccinated need to be wearing a mask? Who are we protecting? Are we wearing a mask for the vaccinated? Where's the logic here? Your logic assumes that the unvaccinated are infectious, COVID-carrying, oozing germs. The truth is that those that are asymptomatic or have no symptoms are very unlikely to spread COVID or anything else. And that's the science. Your mantra last week was get vaccinated. Every citizen should get vaccinated. Have you the numbers of the Douglas County citizens who have acquired COVID immunity. The science also shows that if you've had COVID, you have immunity most likely for life. A paper just came out this week that demonstrated those that already had COVID have immunity. So why would we be getting the vaccine? I've had COVID, so I don't want to wear a mask. I don't need to wear a mask. I'm not going to spread COVID. So why again are we pushing the vaccine? The vaccine, those who have COVID have real herd immunity. We are that wall of protection. If you don't know, those that have had the vaccine.
Your 3 minutes is up.
Okay, let me make one more comment. Commissioner Portillo, last week you took issue with those individualistic framed comments. We still live in a country that is not a socialist country. Individual liberties are important. And if you're concerned about, those who are individualistic, I ask you, why are you sitting at home? Why are you not here talking to your constituents who elected you? We have plenty of room for social distancing, but yet you all cannot come here and look us in the eye and tell us
Ma'am,
the
as I said, your
problem.
3 minutes is up.
Thank you.
Is there anyone else who would like to speak at public comment? Okay.
My name is Linda Campbell. I live at 4124 Wimbledon Drive. I've lived in Lawrence all my life. I love Lawrence. I do not love what you are doing to my city. As leaders in Douglas County, why do you choose to spread fear rather than confidence? There are treatments for this COVID, and the survival rate is high. People will be all right if you will tell them they'll be all right. Why are you using Zoom meetings which demonstrate your fear of being with me and other Douglas County citizens? The rest of us show up to work and do our jobs. You need to listen to different doctors who are living in the same world I live in, not some who do not understand liberty and freedom. This country was built on freedom. We are one of the last Kansas counties to be gripped by the mask mandate. As was pointed out to you last week, there are plenty of scientific studies to prove that wearing a mask has very little or no effect on the spread of COVID. It only spreads fear and blocks social interaction between people who are normally friendly, confident citizens. Why do you choose to not properly inform my fellow citizens that the survival rate for most people is 99.97, better chances than seasonal flu? Why do you not properly inform people that there are successful treatments for those who become infected with COVID? Why do you not inform our citizens that doctors who have treated their COVID patients with medications such as ivermectin, hydrochloroquine, and other treatments have been successful at keeping their patients out of the hospital and recover rapidly? You have been presented many times with information to back up a decision to remove restrictions on me and my fellow Douglas County citizens. Why do you choose to burden us with fear and business crippling restrictions? When I am out among my fellow citizens, I am seeing more and more people not wearing a mask and being willing to take charge of their health. It makes me sad to see children who are the least at risk of catching or spreading the COVID being taught to fear leaving home, fear hugging their grandparents, fear running and singing without a mask. Mask wearing on children is child abuse. Mask wearing represents fear and blind obedience, not science.
Like to speak for public comment? state your name and address for the record?
Hello, my name is Linda Weinmaster. I live at 321 Stone Ridge Court. The other ladies made so many points that I was going to make, but one point last week during the meeting, they talked about the theoretical VAERS, Vaccine Adverse Events Reporting System. And I have a 30-year-old son with a vaccine injury that lives with us at home. I have 3 sons, he's the youngest, and I also have 3 grandkids. And I'm quite concerned about where we're headed to these kids. That my son developed normally until his 2nd year of life. After a round of vaccines, he fell apart. He could no longer walk, talk, or sit up at 2 years old. We have had multitude tests, but in 2003, I contacted the United States Department of Health and Human Services, and I requested using his vaccine lots, the actual lots that he was injured by. They sent me 474 pages. This included 11 dead babies from the exact shots my child had in his first 6 months of life. So vaccine injuries are real. First, do no harm. I don't know why we're doing what we're doing, but this is sad. My whole family has had problems with vaccines. Even my neurotypical children, myself, I suffer greatly from vaccines. I'm Rh negative. I had a shot and I lost a baby at 14 weeks in utero. So my family cannot take a shot. And we all had the disease. So how do you decide who gets to wear the mask and who doesn't? We have natural immunity. I'm really upset about this, but vaccine injury is real. And I don't know if you can see this, but this is from the United States Department of Health and Human Services, and I had to go through file after file to find this data. I just hope we absolutely move forward and leave this behind. The disease wasn't that bad. I survived, and I have tons of autoimmune diseases, and I made it. Thank you.
Anyone else? Last call, hurry up, come on. All right, thanks. Name and address for the record?
My name is Matthew Markham. I live on 5204 Stone Creek Court. This year during wrestling season, I caught COVID early January, and there was a post about me, pretty sure it's Journal World, and I got all this hate for it, for a test that it was false positive. I had 3 other tests within the same week, one right after it that came up negative, and then another one that also came up negative, and then I got a different test that also came up negative. Also, in our sports program for wrestling, we have to wear a mask the whole practice. I would like to see most of you people on that Zoom meeting go through a wrestling practice with a mask on. It's very difficult. And I also don't think you guys understand how difficult it is to wear a mask while wrestling too, because that's now required for wrestlers to wear a mask inside Lawrence Free State, but no other high school is. So that's all I gotta say.
Anyone else? Anyone else? Okay.
Thank you, Sarah. Jill, do we have anyone online for public comment?
We do, but just 1 second.
Jill, I can help move them over if it's easier.
Yeah, thank you. Sorry.
Okay. Anne, you've been promoted into the panel to provide public comment. Please give your full name and address for the record, please. And you're in the panel, so if you want to unmute yourself, you can address the commission.
Here it is. Okay, I unmuted myself. Hi,
Thank
my name is Ann Spitz. I'm a Lawrence resident. I wanted to make a couple.
Give your address.
748 East 1485 Road. I wanted to make a couple of comments. First of all, I don't know if you're aware of this, but the PCR tests that they use to diagnose COVID aren't actually useful for diagnosis. They are research tools, and they were being used at much higher cycle levels than they should have been, up to 45 cycles, until January 20th, where the WHO suddenly dropped it down to 28 cycles, I believe. So every test that was given prior to that has a 97% error, false positive. So we can't be comparing. This is apples to oranges comparisons, first of all. Second of all, I have provided research to one of the doctors there. I emailed it. It's not a Russian study. It's a US study. There are studies all over the US that show that masks cannot stop COVID viruses. COVID viruses are minuscule. The holes in a typical cloth mask, it's like a mosquito flying through a chain link fence. This is not science. This is anti-science. That's 2, mask, 1, PCR test, 3, the VAERS. There have been more deaths from this COVID vaccines in the last 4 months than in the entire prior 15 years that they have been giving vaccines for all vaccines. 15 years of vaccine deaths compared to 4 months. Are you kidding me? And they never tested these vaccines on children or pregnant women. Why is anyone suggesting that we should give these vaccines to children? This is ridiculous. It's not scientific. It's anti-science. Third, there is actually a lawsuit right now against giving these vaccines to children. There's a lawsuit against Drosten, who created the PCR test. There are lawsuits all over the world about these things. And masks restrict the amount of oxygen going to the brain. They are dangerous for people to be wearing masks all day. And they create psychological problems for children who need to see people's faces in order to develop psychologically properly. So people who are advocating masks for children are advocating child abuse. And if you don't believe me, I can provide you with data for this. And shame on you for not finding out this data yourself. Third, or last, you are not my mother. I am a free American. I get to decide what is best for me. You can offer me advice about what I should do, but frankly, from what I've seen of this meeting, I do a much better job of figuring out the science and what's best for me than you are. So I am not going to be taking your advice until you get up to speed on what the science is. And I am a free person, and I am not wearing a mask because it's stupid and anti-scientific. And lastly, the science shows that these are aerosolized particles that spread so far that 6 feet doesn't help. 30 feet doesn't help. If you're in a room with someone else that's got
Ma'am, your
COVID,
3 minutes is
it's
up.
going everywhere. Okay, thank you.
Sarah, do we have anyone else online?
Yes, we do. Nate. Nate, you've been moved into the panel and you can provide your public comment. Please state your name and address for the record.
Yes, thank you. My name is Nate Mortius. My address is 504 Arrowhead Drive, Lawrence, Kansas, 66049. I want to thank you, commissioners, for allowing the order to expire. Thank you for all your hard work. I appreciate everything you do, and I'm just grateful. Thank you.
D, you've been moved into the panel. You can unmute yourself and provide your public comment. Please state your name and address for the record.
Hello, my name is Dee Steinbach, and I'm at 2132 East 26th Street, Lawrence, Kansas, 66046. I want to thank the commission. I know you guys are in a tough position, and I appreciate all your hard work. I appreciate the doctor's input. However, I have to say I have read a lot of studies from CDC, from the NIH, and several other sources, and I have to say I'm not sure I'm in entire agreement with that, especially since this vaccine is still experimental and is not been tested, as we've said. Last week we talked about the science of masks. I feel like we've been over and over that. I'm not going to repeat that. But this commission was really advocating about waiting until children could get the vaccine, and I do not like the where that's headed without the science to back up. There's no long-term side effects, because I have a family member who did get the vaccine and now has heart arrhythmia. He's a young adult. He is yet to find out if that heart arrhythmia is going to be treatable or how long it may last, but he's been dealing with it for nearly 3 months at this point. I hesitate. I think if I had younger children, there is no way I would even consider it with a 99.999% recovery rate and like no hospitalization, you know, when we're speaking in those virtual risks. I just really caution that the way we're pushing this and thinking about this for our overall health. And I know everyone needs to risk assess for themselves. And I really hope that we move forward in thinking about making people aware of what the risks are and aware of what the benefits are so that they can make truly informed consent. Because my family member who has the heart arrhythmia wasn't informed of any potential adverse events other than a sore arm. And he was not even informed that it was still technically an experimental vaccine. He thought it was licensed just like all the other vaccines. He was not even aware that it was a new technology. So I really caution us and want us to think about how we still don't have all the data on this, and that the medical data is still being collected and will be collected for several years to come. I appreciate your time, but I also want to hear more conversations about the early treatments. I don't want it to be out there. People are scared to death because they don't know that they could get treatment if they do fall ill. So thank you for your time.
Nicole Vanicola, you've been moved into the panel. Please state your name and start your public comment. Thank you. Nicole, you need to unmute yourself there you go.
There you go. Sorry, my computer glitched for a second. But you can hear me okay?
Yes, we can. Thank you.
All right, thank you. Again, my name is Nicole Vanicola, and I live in Eudora, Kansas. And I do want to say also, I know you guys only had a week to put things together from last week's meeting, and we had a lot of comment in that last meeting. And I must say that I'm really grateful that, and I know Dr. Marcelina, you had stated too, that that the numbers show that children are indeed in a much lower risk, and so that you were basically in favor and confident in the citizens of our county to handle lifting their restrictions because the children aren't at risk, and that you're confident in the adults and everything like that. And so I just want to urge all of you to remember that you can be confident in your citizens. And so I just thank you for giving us for agreeing to allow this, even though, I mean, we do live in a free country and none of these mandates are laws, and we can still choose to do what we feel is best for our own health and our own family. And in that regards too, I also just want to say, any of these recommendations. And again, I appreciate recommending that the mandates expire because we've never before been forced or even required to follow even our own personal doctor's recommendations. We've always had a choice. That's the beauty of the country that we live in. I mean, how many of us, and I'm sure, like, I'm raising my hand right now, have had our own doctors suggest that we should exercise more? And if we don't, then we don't get to go to the grocery store or a restaurant. Okay, maybe not that last part, but how many of us have been told that we should exercise more for our own health, and then we get to choose whether or not we actually do that? I'm sure that there's a little bit of differences there, but just as we keep in mind the least restrictive, you guys keep saying least restrictive, and I know that least restrictive means that we shouldn't even, really be having a conversation about masking children. I mean, when we consider the children's susceptibility statistics and everything, I also just want to share my own experience. I did get COVID in December, and I didn't know, obviously, that I had COVID until I started getting the symptoms. And up until that very same morning that my symptoms started, my children and I have a 10-year-old, a 7-year-old, and a 5-year-old with special needs I'll get into here in a second. But every one of them were drinking out of my water. They were jumping on me. They were breathing my air. They were touching me, slobbering on me. I mean, all the things. And my youngest, especially, she has Down syndrome. She has always been someone that has been, like, everybody always says that people with Down syndrome have a weakened immune system already. This girl has been through so much, and all of that they were doing, drinking my water, breathing my air, snuggling me, touching me, not one of my children ended up getting COVID. And if there was ever a time where somebody should have gotten COVID, that would have been it, but they didn't. Because as the children don't need to have that. And so again, I appreciate you not forcing that on them. And just to remember, as mentioned last week, a couple of different times, I can't remember, I apologize who said it, but we, the democratic process, this, that, or the other, but we do live in a free country, and the governmental process that we have is supposed to be a government that is governed by the people, for the people. Please, 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 commissioners, I urge you to listen to the voices of your people, the voices last week, the majority last week, last month, today. Remember who it is that has helped you to have the position that you hold right now. And I know there's a lot of stress that can come with that. But again, I appreciate you listening and considering the science that's been presented and the truth of the fact that our children don't need to have these masks on anymore. And that's all I have for today. Thank you.
Whitney? Whitney, we've moved you into the panel to provide public comment. If you could unmute yourself and you could provide your comment, please state your name and address for the record, please. Thank you.
Yes, this is Whitney Schneider, 522 Indiana Street. So while you say you don't have any influence on the schools and their policies, I'm here in opposition to that statement. Last week at our son's IEP meeting, the team referenced your mandate multiple times. And the lawyer at this meeting last week, meaning the commission meeting, mentioned multiple times that people with disabilities are exempt from masks or from wearing masks. Yet Lawrence Public School denied our son's written medical mask exemption due to his disability. So in reality, local schools are basing decisions off of yours. Lastly, given all the information provided, I think the commissioners as public servants advising everyone to take the vaccine should acknowledge that they know that some people will unfortunately die as a result of taking the COVID vaccine. Just because the risk tolerance of the individuals on this commission allows them to take and promote a vaccine or any medical intervention does not mean everyone shares that same level of tolerance. Thank you.
Brian Slow. Brian Slow, you're in the panel now. You can unmute yourself and provide public comment. Please state your name and address for the record. Thank you. Brian. You need to unmute yourself if you want to provide public comment. Okay, I think we're going to give Brian some time. Let's see if he can unmute himself, and I'll move Gretchen Reed.
Okay, I'm sorry, I apologize. I hit the wrong unmute button. I did it on my top screen. Brian Slough from at 1738 East 1675 Road. And thank you for the opportunity to address the commissioners and my fellow Douglas County residents. There are two concerns that I'd like to address the county commissioners on today. Both are related to immunity, specifically the county commissioner's position or lack of position on natural immunity and the possibility of a vaccine requirement in any form. I know that was addressed today, but I had this written out because otherwise I'll just stray off what I want to say. So first of all, natural immunity or immunity from contracting C-19. As I understand today, you exclude those who have had COVID-19 as individuals who are safe from infection or spreading the virus. Research indicates these individuals have a robust, comprehensive immune system when it comes to this virus. Risk of reinfection or spreading the virus is virtually non-existent. This data falls in line with what we know about the natural immunity from SARS-1 and SARS-2. Can the commissioners please clarify their position and include those who have had COVID-19 in any discussions moving forward? Second, as a governing body, you have discussed a new mandate requiring individuals to take the vaccine or wear a mask in public. I do understand that has changed after hearing how you're going to move forward, but ultimately you're endorsing an experimental vaccine and leveraging individuals to take it to return to normal. You've even gone as far as discussing the under 12 population and their inability to get a vaccine as a reason to continue with the mandate that just expired. I see these positions as problematic at best, bordering on malfeasance. And so I want to discuss what the risks of the COVID C-19 vaccines are. On May 14th, the CDC reported the following data for incidents within 1 to 3 days of taking the vaccine administered. Over 12,000 hospitalizations, over 29,000 urgent care visits, over 39,000 revisits to the doctor's office, over 1,000 anaphylactic reactions, over 1,200 Bell's palsy reactions, over 4,200 deaths. We have never allowed a vaccine to be administered with these results. In the US, roughly 50% of eligible population has been vaccinated. This aligns with the yearly flu vaccine rates over the past decade. Deaths contributed to complications from the flu vaccines average less than 50 a year. A much different result than the C-19 vaccines that the commissioners have considered as a requirement for an individual to return to normal. It's time to open up Lawrence and let us manage our daily interactions. I do want to also add that I know that the commissioners and the advisors within the county commissioners' intent is for the safety of people of Douglas County. And I think the biggest disservice has been not discussing all of the facts that have come up and to continue to push, just take the vaccine as opposed to talk to your doctor and make a decision for yourself is a big disservice to our community. It's a big disservice to our community. Thank you for your time today. Thank you.
Gretchen Reed. Gretchen Reed, we've moved you into the panel. Please.
Okay. Yes.
State your name.
Thank you.
Yeah. Please state your name and address for the record. Thank you.
Okay. My name is Gretchen Reed. I live at 862 North 1884th Road in Lecompton, Kansas. I wasn't going to comment tonight, but I just kind of wanted to piggyback on something that was said earlier, just stating that I am also disappointed with the amount of fear that has been spread by our public health department and by this commission. While I listened last week, I did appreciate the vulnerabilities personally when the CDC came out with this new recommendation, but I also saw medical public health letting their anxiety roll into public health orders, and that is unacceptable to me. I would like to see preventive measures pushing this vaccine.
Gretchen, we're having a real hard time hearing you.
Oh, sorry. Can you hear me better?
Yes.
Okay. I would just like health officers to start recommending preventative measures instead of pushing the vaccine, ways that will actually keep people healthy over the duration of their life, such as good diet, lifestyle, exercise, taking vitamin D supplements, being outside, breathing fresh air that you don't have to breathe through a mask, and just general hand washing. I think that would be a public service that they could do on their Facebook page and on their website. So, all right, thank you very much.
I don't see any other hands raised in the attendee panel for public comment at this. I don't see other hands raised, commissioners. Thank you.
This is Commissioner Portillo. Thank you. So we'll bring it back to the commission for discussion. I do appreciate the public comment. I also think that it's really important for us to address some of the things that have been said. I don't know if you all have heard recently, but in the past week, Shawnee Mission School District had one of their public meetings actually pulled from YouTube because of how much misinformation was happening during public comments. So I think it's important for us to at least address when we hear some things. I do really appreciate our public health officials here, and public health has been something that's been foundational to our country as a democracy and as a thriving country for centuries now. So public health and public health orders are not unique or new to COVID. We've had public health orders for more than a century. We are discussing specific public health orders during this pandemic, and those have now expired. But I think it's just important for us to think through the history of how public health has functioned within our country and the role of public health orders and quarantining during epidemics and pandemics and the ways in which public health orders have been a part of our country and our country's history. I'll open it up to any conversation from fellow commissioners or our guests.
This is Dr. Marcelino. I was just going to say, I've heard a lot of people talking about preventative medicine, preventative measures, and I think we should take the opportunity to really state that that is important. And, the basis of good health is maintaining a healthy BMI, good diet, good exercise, not smoking. We do recommend vitamin D. And it is shown that if you do those things and you do lead a healthy lifestyle, you will have a better chance against viruses like this. So we definitely recommend that. And I know I've heard that a lot from some of these speakers, and you're right. Those things are important. So we advocate for that and want everybody to do that. I will say also, in regarding some of the comments about the vaccine, I just was on the CDC website, and there have been over 359 million vaccines in this country administered thus far. And if you think about the sheer number of that, and you think about some things that can happen to people just throughout life, we have to be very careful about taking things like hospitalizations or deaths or illnesses or things that happen to people at the same time they may have gotten the vaccine, because we forget that there's a background rate for this stuff too. So this stuff is happening to people at a normal background rate, and to link it to a vaccine, is not something that we have to be careful about that. And so what I'm trying to say is that the amount of vaccine that's been given, we wouldn't be promoting it if we didn't think it was safe. And looking at those background rates of different things that can happen, that's what they're doing with analyzing all the data, and the vaccine is holding up, and its safety profile is doing well, and so we do recommend it.
There's a lot of, oh, go ahead.
Go ahead, Dr. Scrimption.
I appreciate your comment, Commissioner Portillo, about the Shawnee Mission School District. It's apparent to me that there is a lot of misinformation. I mean, some of this, like preventative measures, yeah, leading a healthy lifestyle will help you. You're less at risk for severe disease. But it's associated, leading a healthy lifestyle means that you are less likely to develop hypertension and diabetes and other things that have been identified as risk factors for severe disease. So yeah, those things are important. And I think we've already, to the people that discuss this, we've already had conversations about making sure we include this information. It's more front and center. But there's a lot of misinformation. I really don't have time. We don't have time for me to go through every single point. But to echo Dr. Marcelino, raw numbers are great, but it doesn't tell the full story of the millions and millions of vaccinations that we've done to this point. Sorry. Masks work. That's not even debatable. Unproved therapies. We do have treatments for COVID. We treat people with monoclonal antibodies. We treat them with remdesivir. We treat them with steroids, which steroids I think is the most important. But unproven therapies like ivermectin and hydroxychloroquine, we go by what the FDA, NIH, CDC tells us. And I've reviewed the studies. I have to intermittently go back and look at this stuff. There's a body of data that they use to make these recommendations, and none of those are recommended. PCR testing is 99 point whatever % specific. If it was positive, unless there was a lab error, it is positive. It's genetic code that PCR is looking for, a specific signature. So if it's positive, it's positive. I can come up with different situations for why it would be negative subsequently. The CT values, some of the testing is too sensitive. However, it's still positive. Whether or not it means that person is actively infected is another question, but it is positive. So I appreciate the opportunity to speak to some of the misinformation. Like I said, we could speak about this for hours, but I thank you for that.
Yeah, I want to thank both of our health officials for commenting on that. And I maybe my comments to head us in maybe a little different direction is that as we look for our health order to expire, I would like us to just pause for a moment and consider all the work and effort that has been done by so many in the community to get us to this point. We have been on so many calls. We have been on Zoom for so many times, trying to make the right decisions for our community, trying to make the right decisions on not just about what we're going to do, but how we're going to do it. Our vaccine clinics were really exceptionally run, and I want to thank Dan and all the partners. And I do not list them because I'll miss some. There's so many great ones. I appreciate our unified command approach to this, because I don't think we would have the confidence today that our community could stay healthy if we didn't have a unified command approach. And my intent last week was to stay one more week with that and really keep us safe and ask our community to give us 7 more days to get through our school year. And I really appreciate our community for following those health orders, our restaurants, our retail, our retail locations, our grocery stores, our schools, so many people for doing what we needed to do to keep everybody as safe as possible, even when that meant limiting our own personal freedoms and the idea that we might be able to maintain health and safety. And so I think while we could get into a discussion about, and we certainly should have those discussions about what the science says, I think at this point for me, what's more important is celebrating what the community has done to get to this point today. Because I think that's really a tribute. We have a lot to be proud of in Douglas County for how we've responded to the pandemic. And I don't want us to get into I don't want us to forget that. I guess that's the important thing. It's not over today. It's another chapter, it's another page. But just tremendous gratitude for so many people on this call, so many people across our community who have done so much to respond to this incredible challenge.
Excuse me, this is Commissioner Reed here. I want to echo those sentiments shared by Commissioner Kelly, and I've had a lot of correspondence and conversations with folks where I have heard that feedback and heard that sort of community pride amongst a lot of people about how far we've come in recovery thus far, and how well we have mitigated the spread throughout the community in comparison to some other communities. So I think that I think that's because of a lot of different strategies and a lot of community commitment. And I just want to take the opportunity to say thank you to the community for all of that, and especially for the last 7 days, which I know was frustrating and difficult for some folks. That was the choice that was made by us as a commission last week. It felt like a good harm reduction strategy from my point of view, and it felt like it gave us an opportunity to get through the school year and get through graduation and those things we've talked about, and also to have a bit more time to respond to all of the information and the varied opinions and varied perspectives of people throughout our community, and what that reaction to CDC guidance changing looks like. And I'm grateful to health officers for coming back this evening with us and really delving in kind of more in depth to the guidelines that we have going forward, and the acknowledgement that we don't know what's to come, and we have to keep being responsive to the situation that we are in as a community, and be vigilant about paying attention to things as they shift, if they do, and how to be responsive in that moment. So I also just want to thank so much of the public for reaching out and making your voice heard and making your concerns heard, and appreciate that there has been continued patience for a lot of people. And I, for one, have had some really great conversations with folks in the past week that helped me gain some further perspective about how this has had an impact, both positive and negative, for people. And so moving forward, I am hopeful about where we're headed, and I think that there is some good feedback we've heard about how to do more public awareness and promotion of health preventative measures, and again, just promoting guidance and safe practices about how to reduce the harm moving forward. As we know, COVID continues to be with us and be something that we will navigate. So.
This is Commissioner Portillo. To bring this conversation to a close or wrap things up, as I said at the beginning when we opened up public comment, we have no vote to take. So it looks like our public health orders are expired, and we have really fantastic recommendations from our public health officers. So I would just like to encourage folks in our community to continue to follow those recommendations. Sarah, do we need anything else before we move on to our next agenda item?
No, commissioners, we don't.
Well, thank you all for being here. We really appreciate the presentation and the information. And we will move on to appointments. Sarah, do we have any appointments to consider today?
Commissioners, I don't believe we do. But unless some of the rest of you do.
Sarah, maybe while you're checking, I'll just give commissioners, we have a planning commission position, and I have started visiting with a couple of the people who were suggested to us and a couple others. And so I think in the next week or two, I haven't forgotten about it. We'll get to that appointment and I can give you some information about that. So just didn't want you to, we keep seeing in our agenda, didn't want you to think we weren't working on it.
Really appreciate the update, and please take your time to make sure that you can have conversations with folks. We are not in a rush.
I don't believe I have anyone else, commissioners, but I will go back and Robin, I'll go back and look through our email and make sure that we haven't missed anyone for next week, or for actually the 9th.
We will move on to miscellaneous. Do you have any miscellaneous for us, Sarah?
Actually, commissioners, I did not get a memo done this week with budget preparations and health orders. I did not make it happen. I do want to remind anyone who's listening and that we will not have a commission meeting next week, next Wednesday. Our tradition is to take, if there are more than 4 Wednesdays in a month, we take one of them off, and there are 5 Wednesdays in June. So we are taking off the 2nd. That's all I have, commissioners.
Thank you. Do you have miscellaneous from any of the other commissioners?
I don't have anything. Thank you.
All right, then I think we are ready we're ready to adjourn. Thank you all.
Good night.
Thank you, commissioners.